All right. Well, welcome everybody back to the start of the semester. This is the UCSF-Stanford CIRSE FDA Distinguished Speaker Series on Cybersecurity for Biomedical Engineering. We meet on every third Thursday of the month during the academic season between September and May, and it's great to be back for the fall 2024 season. My name is Professor Kevin Fu. I'll be your moderator today. I'm the seminar series coordinator. And again, welcome. This is actually the 22nd CIRSE FDA Cybersecurity Seminar. And again, I'm Kevin from Northeastern University, where I direct the Archimedes Center for Healthcare and Medical Device Cybersecurity. A disclaimer before we get in today's fireside chat with Terry Rice from Merck. This seminar series does not represent official FDA policy or guidance, and the contents are those of the speakers and do not necessarily represent the official views of nor an endorsement by FDA, HHS, or the US government. This seminar is being recorded. The recording will be made available on the CIRSE website, which is the same site you used to register for the seminar. A little bit about myself, again, from Northeastern University in electrical and computer engineering and the Corey College of Computer Sciences and the Department of Bioengineering. If you'd like to connect with me, you can find me through your various search engines. All right, so let's level set. A lot has gone on during 2024 when it comes to healthcare cybersecurity. Now, earlier in this year, the federal government launched an investigation into Change Healthcare after an attack, a ransomware attack, brought down major critical infrastructure for how the billing works and how physicians get paid and reimbursements get made in the United States. And this disruption is still going on today with some providers talking about slow payment systems. And so cybersecurity remains at the forefront of some of the major problems and challenges for making sure our healthcare delivery is resilient and can remain available to deliver patient care on a timely basis. At the same time, don't forget that a companion to cybersecurity is general high availability and just reliability in general, which is part of resilience. And so unless you've been living under a rock, you probably heard about a major outage in July from a piece of cybersecurity software services that accidentally brought down a large part of the economy, including healthcare. This software update, when it ran amok, accidentally brought down a number of systems, including US hospitals. So how do we protect things, whether it's an intentional adversary who's trying to cause harm, or whether it's just an accident where we're shooting ourselves in the foot from software that goes awry? We know how to fix these problems. The technology to do this is decades old, but it's still very challenging to get deployed in a meaningful way into the marketplace. And so from the government perspective, you've probably seen a lot of articles from Congress, for instance, the Patch Act or the Omnibus Bill. You've also seen from the Food and Drug Administration a number of guidance documents. These are the documents that FDA reviewers will use when determining whether to clear a medical device for marketing in the United States or approve. And there have been a number of new guidance documents this year. So in March, there was a response from the Food and Drug Administration, a response to the Omnibus Bill, known as Section 524B, where it outlines a lot of the requirements and expectations in order to meet the congressional remit. For instance, the congressional remit requiring FDA to do the cybersecurity review of medical devices. There are a number of other guidance documents from the Food and Drug Administration. Nastasia from FDA was our speaker in May, and she spoke quite a bit to these, so we won't go into this in detail today. But suffice to say, we've had 22 just amazing seminar series and lectures and panels, and we're going to continue on that trend today. Before we get into Terry, I want to announce the fall lineup. We have 3 amazing speakers for this fall. Next month in October, we will have Andrea Green-Horace. She is from the Centers for Medicaid, the Centers for Medicare and Medicaid Services, and she's going to talk about a very hot topic, and that is protecting the hospital landscape against ransomware attacks and the loss of life. dovetailing quite a bit with resilience and some of the documents you've seen coming out of the White House on ensuring resilience of cyber physical infrastructure. Then in November, we're going to take a turn into Europe. And so FDA has a large presence all over the world because manufacturing is not just in the United States. And Jan Kufner from TÜV Süd is going to talk about penetration testing. And TÜV Süd is often a delegate working on behalf of governments to do things like auditing on behalf of regulatory authorities. And so again, he'll be speaking on penetration testing of medical devices. We'll have a break in December over the busy holiday period and then resume again in 2025. Today, it's my pleasure to introduce Terry Rice. He is the Chief Information Security Officer and the Vice President of IT Risk Management at Merck & Company in pharmaceuticals. And today we're going to have a fireside chat on public-private partnerships for healthcare cybersecurity. He is right front and center in a lot of the activity going on. There's quite a bit of infrastructure already set up for the public-private partnerships on healthcare cybersecurity, but not everybody knows about them. And so we're going to have Terry enlighten us on this and tell us about some of the interesting ways to get involved. Let me just tell you a little bit about Terry. So Terry got started, he graduated from West Point. So thanks for your service. And he served overseas in Korea and also served at the National Security Agency. And I don't know is that an antenna I see in the background there? I'm not sure. But he's been involved with quite a bit on cybersecurity in the government side and military. But almost 20 years ago, about 20 years ago, he moved into the private sector. And since 2007, he's been at Merck now in the role of Chief Information Security Officer. He also serves on a number of national as well as global public-private partnerships, such as the Health Information Sharing and Analysis Center, the H-ISAC, and he's a former chairman of what's known as the HSCC, or the Healthcare Sector Coordinating Council. And we had Greg Garcia speak about HSCC earlier this year, and we're going to talk about that in more depth today as well from Terry's perspective. But without any further ado, I just want to introduce Terry. And maybe you could just tell us, again, a little bit about your background, maybe expand on this, and just how did you come to find yourself in healthcare cybersecurity?
I didn't plan on it, that's for sure. But before I begin, I want to say I'm honored to be here. I looked over the list of previous speakers and really feel honored to be in such company. So thank you for the invitation. I also want to say I looked over the list of people that are online and to say hello to a number of old friends and colleagues. Glad to see you on there. Hopefully we can catch up sometime soon. I'm on my 17th year as the CISO at Merck, and I like to joke that I'm on a 20-year non-parolable sentence as the CISO. But I've seen a lot that's transpired over that time. But in answer to Kevin's question, I want to back up. I started, as he mentioned, I started my career as a military intelligence officer focused in the signals intelligence arena. And it was an interesting time because this is back in the 90s, and there was a transition that was taking place from traditional radio-based communications to computer-based communications for all types of military operations and so forth. And so we, as an intelligence community, were shifting from looking at how do you intercept RF and other capabilities to how do you intercept computer communications and at the same time defend your own and allied capabilities. So it was a really interesting start for me. And I had envisioned spending an entire career in the military, but I got married, had a couple of kids, and decided that maybe I should spend my time in the civilian sector for a little bit more stability for my family. And so I got out. I kept a toehold in the military by working as a reservist on the weekends at the National Security Agency, and I became a consultant in the DC area. And that was, between that transition, it became an epiphany for me that the government and the military were using civilian resources, contractors, consultants, technology companies to do their mission. And they integrated really well. And they were sharing best practices. They were sharing intelligence to get the mission done. So I saw this nascent public-private partnership in the defense side and started to think about how could we bring this to fruition in the civilian sector. As I started my cyber career on the civilian side, it was many years ago, and I did consulting and then went to J&J for a number of years. We saw attacks like Code Red and SQL Slammer and Nachi causing destruction among the private sector. And at the same time, incidents like Titan Rain in the military and defense side it made me realize like we've got to work together better to respond to these attacks. We're starting to see attacks against critical infrastructure. And again, this is in the early 2000 timeframe. I came to Merck in 2007, and just like most organizations, we developed a very close relationship with the FBI through entities like OSAC, which is the Overseas Security Alliance, and DSAC, the Domestic Security Alliance. And these were good. And we'd have a conference every now and then, but they were almost strictly bilateral relationships, right? So we would talk to the FBI would talk to us. Pfizer would talk to the FBI would talk to Pfizer. Kaiser Permanente would talk to the FBI and the FBI would talk to them. We weren't sharing across, and we were sharing very little beyond the law enforcement community. Another epiphany that came to me while I entered Merck. Merck has a federal savings credit union for all of our employees. And we had this brilliant idea, because there was only one or two ISACs out there, that we should try to get involved with this thing called the Financial Services ISAC. And so because we had that bank, we applied to get into the FS-ISAC, and I was blown away. Oh my God, here we have it. We have intel sharing among financial services companies. We have intel sharing with the government, and the government is pushing both intel as well as best practices into the financial services sector. Now, very little of the very specific data that was coming out was germane to the broader Merck, but it also gave me the idea that how do we go from having a couple of ISACs to really plussing up and having a presence within the healthcare sector. And so a few years later, there was maybe 2011, a couple of us CISOs that were meeting on a regular basis. We got together, Jim Routh, who was at Aetna at the time, Brian Sincero, who was Pfizer, Greg Barnes at Horizon Blue, and a number of others. We got together and said, we got to get this going and create a health ISAC. Now, granted, there was a tiny little legal entity in Florida at the time called the National Health ISAC that had already set up a 501(c) and all the other machinations. So we said, let's partner together. And we created a new board, we created a new capability. And in 2013, we essentially launched this new entity called the H-ISAC. And it started, to grow substantially. Then 2017 occurred. And I can tell you June 27th, 2017 was when we got hit by NotPetya, one of the worst destructive malware events in our nation's history. And it was through that I noticed that the H-ISAC and the relationships that we built through the H-ISAC and the Sector Coordinating Council with the FDA, HHS, DHS, there was no CISA at the time, NSA, and others really helped. We literally had, in the midst of that attack, within 24 hours, some of our peer entities sending people, cybersecurity analysts, to Merck to help us figure out what went wrong, because they had the same tax software in Ukraine that we had was the initial vector of attack. And so they sat beside us. Because we had the relationships with HHS and the FDA and others, we had immediate conversations with them, and they were asking, what can we do to help? And here's the information that we need from you to be able to help manage this. And so all of that history and that backgrounds is meant to say that I could see, the opportunities. I benefited substantially from those opportunities. And so it's made me double down and commit to working as much as I can, as much time as I can in public-private partnerships.
One thing I really appreciate was getting to know you without violating CPAC, right? When I was on the inside at FDA, we would have those weekly calls with leadership for these public-private partnerships, and CPAC really enabled us to share information in a meaningful way. It was just so great to have you on those calls with this energy. I can't say that's universal, right, across the entire industry. So I'm curious, can we bottle how do we bottle this up? Your enthusiasm, because it just really shows sort of the leadership at Merck. But I'm curious, what drives people across the industry and other companies and other peers for them to participate or not, and how can we enable better participation so we can get out in front of these threats?
Yeah. I think that's the critical question. And for those that are not familiar with CPAC, the U.S. government, through the Freedom of Information Act, when you request information, the government is supposed to turn it over as long as it's not classified data. And a lot of what we're sharing is sensitive, but not classified information. Hey, I got a vulnerability that I'm concerned about, or hey, here's a risk of a supplier that is critical for 15 of us. And if that supplier goes down, we've got major problems in pharma or in the healthcare sector. So what CPAC does is it's a mechanism that allows me to share information with the federal government, state government, tribal, local, and not face the potential penalties of that being discovered through a FOIA request from a concerned citizen. And so it gives a legal mechanism, and now there's ground rules and everything that you have to follow to do that, but it gives a legal mechanism that allows information to be protected. And that was probably, I would argue, 10 years ago, one of the biggest stumbling blocks, because people be like, well, we give this information to the government. What are they going to do with it? How are they going to use it? And is it going to end up in, the New York Times or the Wall Street Journal? And so I think the mechanisms with CPAC have become better understood. So that's become less of a barrier. I do think that, particularly in the healthcare industry, and it's a topic I may touch on later, a lot of our industry is delivered through small to mid-sized businesses. Mm. And when you have small to mid-sized businesses, I saw a statistic recently, I think it's like 60% of healthcare delivery in the US is done by entities that are less than 20 people. So in a 20-person organization, you're probably not going to have a dedicated chief information security officer. You'll be lucky if you have a dedicated IT person in that. So I think we've done a good job at reaching out to the larger entities or the more mature entities that have invested in a cybersecurity program and have appointed somebody at least responsible for security of that organization. Where we need to get to is that broader mass out there that there is no security contact. So how do we do that? And one of the things that we've been trying to do through the Sector Coordinating Council and the H-ISAC is to increase awareness at the senior executive level in these companies, right? So the CEOs or presidents of the company, if they're getting a call from either the government or from a senior peer or a partner or the H-ISAC itself, to be able to listen and say, here's a set of resources that can actually help you. So that's part, and I'm sure we'll get into the discussion on the strategic plans and so forth, but that's part of the area that we want to break into. What we've also done, there is no charge to participate in the Sector Coordinating Council. There is no charge. So we can get entities that might have shied away from paying, we don't have a fee there. On the H-ISAC, we've revamped a number of times now to reduce fees for the small, particularly not-for-profit entities, the entities that are small business. That's something that's literally probably cheaper than their coffee budget for the year. So, and there are services that come with that. So I think, the education and awareness is something we still need to work on to continue to draw people into these public-private partnerships.
Yeah, well, I think probably one thing that's driving public and private partnerships with the just unending, endless challenges to healthcare cybersecurity, it feels like we're always playing catch up. And so how do you think more strategically and get ahead of the game? So I'm curious about what's driving your calculus in your mind on what are some of the biggest challenges that you think are facing the healthcare and public health sector, and maybe even an eye toward the future, right? Because there's the immediate news, but there's also what we kind of can predict what's probably going to happen in the next small number of years. That'd be nice to get ahead of.
Yeah, it's a great point, Kevin. But those of us in the security community are often seen as curmudgeons. We're the people that say no. We're the people that are always thinking about the bad stuff. So before I jump in and talk about the problems, I want to say part of what gives me my energy is I couldn't imagine a better place to be as a technologist, as a security professional, as a healthcare person than in this sector right now. There is so much amazing things that are happening. We're on the cusp of making brilliant discoveries that will hopefully help. Personalized medicine. We've been talking about it for 20 years since we sequenced the human genome. We're finally there. There are clinical trials running in multiple companies where you can sequence a piece of genetic codes and then tailor a drug cocktail for an individual. Patient education and awareness through things like online presence and tools and capabilities. Augmentation of the strained healthcare workforce, not just in the United States where we have problems, but all around the world. Look at sub-Saharan Africa and Southeast Asia, where there are lots of shortages of healthcare professionals. And to be able to use technology to augment or offset and help millions of people around the world, it's just an amazing, amazing time. Faster and more accurate diagnoses, the ability to use sensor data, even consumer technology. I was tickled last week. I was watching the Apple releases and saw that they have filed with the FDA. I know that it hasn't gotten there yet, but they filed with the FDA. The new AirPods 2 actually can do hearing healthcare opportunities. And with elderly people in my family, that's something that I would love to see. And the sensors to be able to measure sleep and so forth. So I guess what I'm trying to say, it is so exciting to be in this. And here's the conundrum. If we don't do our jobs in protecting the technology stack, in protecting the data, in protecting the integrity, the confidentiality, the availability of these capabilities, then people are not going to adopt them. People are going to be shy to utilize them. And so let me talk about some of the things that scare me. I mean, ransomware is right at the top of that. The loss of service, the disruptions, the inability to treat, the inability to manufacture products and materials is something that scares, I think, many of us. And that scourge, we're tracking over 300 ransomware families right now as part of our day-to-day operations. I get a roll-up every day of entities that have been hit, partially through the H-ISAC. And there are lots of healthcare companies. You'll see some of them will make the news, but there's dozens, literally dozens of others that are being hit with ransomware that are not big enough that maybe trigger anything but a local news story. But those are all patients that are learning that their healthcare information is exposed or that they have to be diverted to another hospital. Imagine the trust breakdown that can occur as a result of that. The sensitivity of our healthcare data, right? I mean, I don't live a very exciting life. And if my bank information were exposed, yeah, maybe there's one or two things in there that I might be a little cautious about. But if my healthcare information is exposed, that can be very sensitive. And there are conditions that many people have where there's still social stigma associated with that. And we've even seen recently where ransomware operators not only go after the entity, but go after the consumer or the patient whose data is released for additional extortion attempts. I actually think that's going to increase more if we don't get our arms around that, where they go directly, hey, we're going to release all of your, behavioral health records, and, to the public, if you don't pay $1,000 ransom. And so that I see as the next verge of that. Another challenge that we have in healthcare is the interconnectivity of the ecosystem. I went to get my annual physical done recently. The doctor didn't like a couple of things that I had as I get older. But unlike many other sectors, like finance, for example, the interconnectivity, particularly in the US, is a benefit, but also a major potential issue. So a typical visit, like my recent annual, I went to my GP. He asked me to go to a follow-up specialist. I had blood work done by LabCorp. I had a prescription refilled at the local pharmacy. That's obviously administered through a PBM, and I have insurance to offset the cost. So a simple annual physical involved six or seven entities that have to share that information in some degree. 6 entities that all have to have good security for me to feel comfortable with that. So I think that's one of the big issues that we have in the healthcare sector that we need to figure out a way. And I do believe, again, public-private partnerships are part of that. One of the things that we haven't seen significantly, although one could argue ransomware is an integrity attack, are integrity attacks against information. And you can imagine changing a healthcare records, or changing the settings on a medical device, or changing the settings in a hospital on life-saving equipment could actually result in patient harm or even death. That's not something a lot of other sectors have to worry about, and something we do.
Right, and it's interesting. FDA has come down quite publicly saying they considered the delay of patient care harm.
Yes.
In the case of some ransomware that has brought down manufacturer private clouds for, say, radiation therapy.
Yes, absolutely. The proliferation of medical devices, which I think is, again, a wonderful thing, as you're mentioning. There's a tremendous opportunity there to help save and improve lives around the world. But those devices are getting connected up to the home networks often, where you've got Xboxes and, streaming TVs and people working remotely from home. What could go wrong with that, right? A medical device interacting with an Xbox and an Apple TV, let's say. And then the final thing I'll say as a challenge is the acute labor issues. We know there's a dearth of talent in the cybersecurity space. And as I mentioned about the challenge of small to mid-sized businesses that may not be able to recruit a cybersecurity professional or a chief information security officer, how do we leverage the public-private partnerships, the government resources, which I'm sure we'll talk about, like, DHS's, CISA's hygiene service and risk assessment capabilities? How do we leverage those capabilities to ensure all of the sector has the right hygiene, the right controls in place? Those are the things that are keeping me up at night, thinking about each one of those and what we can do. And I double down on, I believe one of the most important ways to address many of those issues, not all of them, is through public-private partnerships.
So we've got a couple questions related to that on the public-private partnerships, and then also your comment on the small business and rural. Maybe we'll start with the more technical one on the small and rural. So one of our attendees, Raj, is talking about how in the electric grid community, there are also lots of small and rural providers who basically don't have the capability to do meaningful cybersecurity anything. It's very, and I think as you pointed out, some of these small places don't have a cybersecurity person, let alone an IT person. So he wanted to know about the use of tools, and so for instance, delivering tools to a large company is very different from delivering a tool to a small company. You can't simply throw it over the wall. So I'm curious if you've seen in your circles just effective ways. Are tools an effective way to help small, but even if so, how do you adapt this to be usable by an entity that might not have the specialized staff who are trained in how to use it?
Yeah, it's a great question, and I don't think there are any easy answers, right? Because I agree with the proposition. There are freeware tools out there. There are dozens, hundreds of freeware tools. The problem is, do you have the right people to run and manage those tools? And so that dearth of talent becomes a significant issue. And so how can you partner to be able to find that talent or co-use that talent, or to work with, and I have to commend, I've also got issues and sometimes, but I have to commend companies like Google and companies like Microsoft that have recently set aside capital to help small and mid-sized healthcare companies because of the devastation that's been hit in those areas. So, there's been a lot of focus around one of the things that when I was on the healthcare industry cybersecurity task force back in 2016, one of the things that we looked at was the Stark Law, which prevented healthcare entities from doing self-referrals and so forth, right? So there were issues with doctors, and I'm sure many of you understand that. But it also, because of the way the law was written, precluded us from being able to help each other from a cybersecurity, to give services between organizations because there might be value associated with that. So there's been modifications as a result of a recommendation that came out of that task force to allow for some of that peer-to-peer partnering to take place. So again, the challenge, I think, probably one of the bigger ones, is how do we increase that workforce and that talent pool to be able to take advantage of those tools? Now, I may say something that's a little controversial, particularly for small and mid-sized businesses. I do think the use of cloud technology, which does have its limitations, the use of cloud technology can help obviate some of the challenges, right? So the Cerners and Epics, they have a much bigger staff, a much larger and more developed cybersecurity capability that are looking how to protect that, versus if you had all of that federated out, you may not have the staff there to be able to accurately and effectively secure it. Now, there is a separate risk as a result of that concentration risk. So if a Cerner or Epic goes down, that impacts a lot more people. But from a pure cybersecurity protection capability, I believe cloud-based resources with the right entities actually helps to uplift, particularly for small and mids.
Okay. And then just one more final question before we go back into our dialogue. Since you mentioned, again, public-private partnerships, and I think we'll get to this at the end again, there's just general questions. How does one get involved in that if they're in the private sector, let's say, in the healthcare community? What are some ways you think that people should be looking into how to get involved?
There are probably the entry points for both the H-ISAC and the Sector Coordinating Council are the working groups. There are working groups on the Sector Coordinating Council side, specifically within the Cyber Working Group, and in the H-ISAC. You don't have to be an expert. You look at the list, you figure out, hey, this is germane to me, or this is something that I'm interested in, and you jump on in. And in fact, we have an OT, an operational technology security working group in the Sector Coordinating Council. And one of the co-chairs of that is a gentleman that works on my leadership team who only recently moved over into cybersecurity. He's got a really strong manufacturing background. And he said, okay, I can use this to provide my expertise on the operational technology. And in return, the people participating in that group are going to hopefully educate me on the cybersecurity concerns so I can bring that back and apply that to Merck. So that's probably the best area for jumping in. Obviously, if you're not a member of the H-ISAC, we have to onboard you and become a member. If you're not a member of the Cyber Working Group or the Sector Coordinating Council, we have to make sure you go through the paperwork to understand your CPAC responsibilities. But it's a relatively painless process. I will provide Kevin the email addresses for the right points of contact in those respective organizations. So anybody that wants to participate. And I'll tell you, it's a lot of fun. We have, even when we get together at least twice a year for each of those groups, we tend to have workshops and get to meet people and network and, have lunch or a drink or something together. It's a pretty collaborative, cordial, group. And I would encourage anybody that's not participated to find an opportunity to do so. And from that, you can expand into other, even leadership roles. We're always looking for people that want to take on even more responsibility and be a board member at the H-ISAC or be an executive committee member on the Sector Coordinating Council.
All right. So it sounds like you're going to be getting some fresh blood.
We would love it. We would love it.
So one thing you haven't talked about is maybe the elephant in the room for the whole marketplace, right? I'm thinking 2 letters and 3 letters. Let's see. AI obviously is one big one, and then a little more niche would be maybe LLMs, so large language models, and a lot of the generative AI is just changing the way we do things. It certainly changes how education is delivered. It changes how my kids are doing schooling. How is it changing healthcare cybersecurity?
I think we're only scratching the surface right now. So, there's lots of opportunities in healthcare. First of all, to take out costs with even simple basic capabilities like ChatGPT and Copilot and so forth, of streamlining the basic work that we do, right? Generating papers, generating SOPs, generating incident tickets, and so forth. I also believe that as we play this out, that there's going to be revolutionary changes to the healthcare, being able to get products to market sooner, being able to do diagnosis faster, being able to provide coaching to patients on how to mitigate a disease or condition that they have. But you asked about cybersecurity. And so I think there's going to be an interesting play that goes between us, who are trying to use it to secure the enterprise or secure the healthcare sector, and those that are looking to cause harm. And so I think we're still nascent. I know, I used to be on the sales side for a period of time. Every vendor and their brother now has AI enabled as, sort of the tagline. I still think we have a ways to go, but even Copilots and the likes of LLM technology, I think can be used in cybersecurity operations. For example, taking the often obfuscated URLs that we get in phishing emails and being able to push those through a LLM to determine what is exactly happening with the URL, changing the language if there's file names that are in different languages, being able to parse lots of threat intel that are coming into the system and generating gists or abstracts of that intel, so you can figure out, doesn't apply, don't need to worry, this one I need to worry about. And being able to do that, one of the things that I feel completely overwhelmed, and I'm not even in our threat intel shop 24/7 of what I get, which is a fraction of what our team is getting and a fraction of what like the H-ISAC is getting. How do you use that to be able to abstract and glean what are the critical actions that you need to take in a short period of time with that? I think a lot of us in the cyber community, there's a lot of technical depth. There needs to be a lot of technical depth. Sometimes that isn't communicated as effectively. I think LLMs can help do that. We've started to use for example, taking notes as an incident gets opened and abstracting that for a summary of the incident ticket that is in easy to understand and utilize. Now, I think we'll be doing much more, right? I think we're still in the early stages of the utility of LLM models. Now, we also have to, as I'm sure everybody on this call is aware, worry about how the threat is using LLMs for their purposes. You know, the quality of phishing emails, right? For those that have been around a while, you remember when you used to get a phishing email, it was in broken English, poor grammar, lots of spelling errors, had no relevance necessarily to you as a specific individual. It was create the message, fire it off to millions of people, and hopefully you get somebody who clicks and interacts with the message. Today, you can use LLM technology to be able to target and tailor messages for individuals. And we've seen the emergence, although I don't believe there's been widespread attacks. Somebody on this call may correct me, but I don't believe there's been widespread attacks where they've used the code development capabilities of LLMs to create more efficient malware. There's been experimentation, but I don't think any significant, at least not that I've read in the recent past.
Well, I've personally used binary analysis tools with LLMs to pick apart some of the machine code, and it would very quickly tell me why it wasn't disassembling it properly and zeroing in on some of the. So if it can work for me, it can work for anybody.
Yes, absolutely. Right. I'm not saying it's not being done. I just haven't, I don't think we've had the front page sort of this was done by the use of LLM technology to create the most effective and efficient malware. The only other thing I'll add in here, Kevin, is as we get enthusiastic about how we apply this to the security area, we do need to make sure we keep in mind there are issues with bias, there are issues with ethics, there are issues with privacy, there are issues with integrity, there are issues potentially with copyright violations. So you need to make sure that as you're enthusiastic and tackling some of the day-to-day problems, you're looking at the broader picture and not discounting them as issues, right? And getting the right people involved, the Office of Ethics, the Office of Compliance, lawyers, and so forth, as painful as that may be for people wanting to use some of that technology.
Yeah, and I guess AI has its own subfield of explainable AI. It'd be nice to see explainable anything in this space on the cybersecurity. I mean, it's all a big black box. But there are a lot. So some of these things are more like third-party tools, it sounds like, especially if it's a cloud service. And we actually have a question in this space about third-party service providers. And so for smaller organizations, they might have to use third parties because they don't have the in-house resources, but they also might not be familiar with what risks they're taking by using a third party. And so are you going to put all your eggs in one basket? Are there some things from these public-private partnerships where small entities might be able to leverage what's already been learned by other small entities or even the large organizations on how to manage that risk from third-party services?
Yes, and in fact, we do have workshops around third-party risk management as part of the H-ISAC, and lots of discussions about what are the best practices. In fact, we tried to do something, and it's frustrating that we haven't got the engine going yet. We tried to do something that the Financial Services ISAC did a number of years ago, and they've struggled a little bit with it. They've made more headway recently, is a shared assessment framework where if you have a common entity that is supporting lots of healthcare organizations, could you come up with a risk assessment matrix that could be done once effectively and then shared amongst the multiple customers or partners with whom that entity interacts, so that you could. Now, there's been for-profit entities like BitSight and Security Scorecard and others and they've got a great business model around that to sell, at least the perimeter scoring. But I think we need to do a better job at standardizing so that we could share that. It behooves the entities that are being assessed, right? Because if you're getting a knock on the door every couple of days from one of your customers or partners saying, hey, we want to do a risk assessment, you're going to have to establish a small team that does nothing but answers the questions to the risk assessments. So I do see this as a tremendous opportunity for us in the private sector to be able to come up with these models and utilize them more effectively. So I'm all ears for anybody that has ideas on how to tackle this problem. There's a tremendous amount of waste that is going in right now because of the numerous evaluations that particularly the tech providers in the healthcare space are going through with every single one of their customers.
So, okay, well, so we've talked about third party, we've talked about public-private partnerships, and then you've also brought up two organizations in particular, H-ISAC and HSCC, so Health Sector Coordinating Council. A lot of acronyms here. If I'm a newbie or maybe just getting introduced to the public-private partnerships, maybe I've worked in healthcare cybersecurity for a while, or maybe I've just been tasked with it either at a hospital or a manufacturer. What would I go to one or the other? How do I divide them up in my mind?
Yep. It's a good question, right? Especially if you're not like I had a lot of federal experience and background, so I knew the concepts when I came into the workforce as a, into the healthcare community. But if you roll back, all the way back to the Clinton administration in the 1990s, Presidential Decision Directive 63 was the first sort of executive order that created this notion of information sharing and analysis centers and sector coordinating councils. And the idea was that because there are 16 critical infrastructures in the US, which are almost exclusively owned by the private sector, how does government work with the private sector and to ensure that we have the right controls in place? And so the sector coordinating councils that were stood up for each one of the critical infrastructures had a complementary government coordinating council that would work together. So if you think about healthcare, yes, HHS is a huge player in that space, but it's not the only player in that space. The Veterans Administration owns and operates one of the largest hospital networks in the United States. You have agencies like the FDA and CMS. You also have state, local, tribal healthcare entities and public health facilities in the local areas. So how does the government coordinate amongst itself, and how does the private sector coordinate amongst itself to come up with best practices? What are education and awareness about topics if there is the potential for, hey, maybe there's a new standard we need in an area. Maybe there's something that we can uplift everybody at the same time to educate and then inform each other. And so today, the Sector Coordinating Council works closely with the Healthcare Government Coordinating Council to deal with myriad topics. And often, the Sector Coordinating Council has produced 27 publications that are freely available on its website. I'll give the URL to Kevin if he doesn't have it. 27 today that cover a wide gamut of topics. Some of those were done jointly with the Government Coordinating Council. And so it has an HHS logo and a Sector Coordinating Council logo that is sent out to the masses as a free resource to be able to utilize that. The topics that the Sector Coordinating Council deals with are generally more focused on policy, law, strategy, longer term items. Think more, for those of you that are in the cyberspace, more the GRC topics, governance, risk, and compliance, than the tactical operational activities. Now, the ISACs are the ones that cover more of the operational activities, the intel day-to-day, 24/7, the incident management capabilities, the best practices on how to escalate, the best practices on how to investigate, do forensics. And so the H-ISAC is really works closely with portions of HHS, specifically some elements within ASPR, the Assistant Secretary for Preparedness and Response, and more closely with the HC3, which is actually within the Office of the CIO, I believe, which is like a nerve center within the healthcare. Some of you may have seen the HC3 publications, which have gotten phenomenal. I read all of them that come out. But they're working very closely on the tactical. They also work closely with CISA on that. It's interesting. On the Sector Coordinating Council side, we have 438 organizations that are participating with over 1,000 people. Policy, regulatory, strategy, long-term. On the health ISAC side, we have more than 12,000 security analysts that are in the healthcare community that are interacting on a daily basis. We have a chat and a portal in the chat area. Hey, I saw something. Here's the MD5 hash. Oh, I saw the same thing last week. Here's an IP address associated with that. Oh, you know what? I want to report this to CISA, but I don't want my company's name associated with it. Okay, the H-ISAC will take that and pass it on to CISA or the FBI or HC3 and say, a member has provided this intel, right? So it provides an avenue to get tactical, near real-time information into that. Now, there's a lot more that goes on, right? It's not just about the intelligence sharing. There's a lot more that goes on within the H-ISAC and the Sector Coordinating Council. But I'm trying to keep it simple for those that do not have a background in this area.
And some of the markets, like maybe you can tell me more about the financial, but the FS-ISAC, I think of them as the ISAC you go to for financial. But in healthcare, there are actually several. And I'm, when would one go to one or the other, or is H-ISAC just sort of the mothership? What drives it, and how does an ISAC get born? Like,
so yes, there have been. So it's interesting. I think it's actually an affirmation of the concept. So there are 16 critical infrastructures, and there's 16 designated ISACs, and the Health ISAC is the designated entity for the health and public health sector. But the idea of information sharing it goes well beyond the 16, right? Hey, we got retail, we got operational technology. You know what? We can get operational technology people together that are cross-sector. Hey, the chemical industry, the foods manufacturing, the pharmaceutical manufacturing. We're all using the same equipment to do the manufacturing. Why don't we get together outside the auspices of like an H-ISAC to also share information unique to things like Siemens PCS7 controllers or Honeywell systems and so forth. And some of that you can cross-pollinate then, right? To be able to say, oh, okay, this came up as an issue. We saw it here. Let's get that over to the H-ISAC as well. So I wouldn't constrain. I think it's a great idea. And I like the concept of almost the marketplace of ISACs to which then you can tailor and focus your energy. We have since dropped out of the FS-ISAC because the H-ISAC has matured, but we participate in the OT-ISAC, which is not a recognized critical infrastructure entity, but we do get benefit out of that because we have a lot of OT in our environment.
So we're coming up on the top of the hour. We got about 5 minutes left, and there's so many more questions we could cover, but there's one that I think I want to get to, and that is, this is the United States, but malware is global. Ransomware is global. What are some of the global elements we might want to be thinking about?
It's a good question because like companies like mine are multinational. We operate in markets all over the world. And even today, we are still providing product into Russia, into China, into Israel, into Lebanon, into Gaza, right? I mean, we have to provide that capability. The sector as a whole has to do that. But you're operating in there, so how do you go about making sure your infrastructure is protected? So both from a sector coordinating council and an H-ISAC, there has been a major push recently, the last 5 years or so, to broaden and ensure that we're thinking globally. So we have a chapter of the H-ISAC in Europe. We have a chapter of the H-ISAC in Asia. We have conferences in Asia and Europe on a regular basis. We're working with allied governments in those, and some of those governments have tremendous capabilities, like the UK, like the Czech Republic, like Singapore. Their sort of CISA equivalents are top notch, and we get a lot of really good information out of them, and also best practices that they might have developed. Europe's probably, I would say, 10 to 12 years behind where the US is in the thinking and the use of the ISACs. I think Asia's a little further behind, although they've made some recent improvements. And a lot of that, it's still bilateral relationships where I deal with the Singaporean government, the CSA in Singapore, not through some regional entity. And that's where I think the opportunity is going to present itself as it continues to mature. I think Europe will get there first through entities like ENISA, which is the European equivalent of CISA. They've been really ramping up their game in terms of information sharing. So I have hope, but we've got a lot of work to do. We're nowhere close to even where the US, and the US still has lots of work that we talked about earlier in this conversation.
So we could probably have a whole panel session on global issues and some of the geopolitics and all that fun. We have one question about being a chief information security officer. First of all, Terry, I don't know if you know this, but Congress just passed a law saying you're not allowed to ever retire. So one of our attendees is curious, about longevity in these kinds of roles. I have to imagine it's a really challenging job. What can be done to sort of foster and grow future chief information security officers and help enable them to stay in those roles and being effective? What are some things that might be on the mind for those working with CISOs or wanting to become one? And how did you manage to be so effective for decades?
Yeah, I know. The joke used to be that CIO meant career is over, and CISO is career is soon over. I think we've moved a little bit beyond that at this point. I think it's a couple of things. One is you got to have a passion for learning, right? There's so much that's taking place in this field, and it's not just about the technology, right? So I still consider myself a technologist, and I love to get into the weeds with our engineering teams and our analysts. But I also have to switch gear and think about laws and regulations and being able to consume that and understand the applicability to Merck. And then you also have to worry about relationship management, because even if you've got the right ideas and the right perspective and the right plan, unless you can influence people within your organization and even beyond your organization, that becomes a very difficult task. So relationship management is really key. Getting buy-in from senior executives so that your senior executives are championing the criticality. I think we've overcome a lot of that inertia, just given the volume of attacks that have taken place. It's hard for a very senior executive to say it's not a priority anymore. So I think that actually helps people coming into these roles, that senior executives are going to be very attentive to those issues. And then the last thing I'll say, and I'm actually going to be speaking with another fellow CISO at the upcoming H-ISAC, you got to take care of yourself. These are some of the most stressful jobs in the world, right? I can't count on my hands the number of Friday nights that have been disrupted by a call from our Cyber Fusion Center, ruining my plans for the entire weekend, right? You got to be able to respond. You got to be able to handle the stress and really focus in on mental health. In fact, what I was saying is I'm speaking on the topic of mental health in cybersecurity at the next H-ISAC conference with one of my fellow CISOs. Because if you don't manage that, I've seen far too many of my peers that have internalized everything that goes wrong in an organization, and it leads to burnout. And they don't want to ever participate in this type of role ever again. We got to stop that. We got to make it a role that people want to aspire to, and they can have healthy and lengthy terms in that. And I also, one of the things that inspires me the most is the passion and energy. I take a lot of time for mentoring, both junior, mid-career, and even senior folks in cybersecurity. And seeing the passion and energy, it's the thing that gives me hope for the future, and keeps me moving forward and wanting to do more to help protect. So thank you, Kevin. Appreciate it.
Well, Terry Rice from Merck, Chief Information Security Officer and Vice President of IT Risk Management. Appreciate your coming to the program and sharing your thoughts on public-private partnerships for healthcare cybersecurity. And tune in, everybody, next month. Andrea from CMS will be talking about protecting healthcare delivery from ransomware from the Medicare Medicaid perspective. And you can imagine some of the knobs there that might be turning on and off. But Terry, thank you again. And I'm sorry we weren't able to get to all questions, but we'll continue this discussion.
Awesome. Take care. Have a good one.
All right. Goodbye, everybody.